Are they coming? Good morning, everyone. Thank you for being here this morning. We're so proud of this place. It's so, I said to Dr. Tai that it's such not only a caregiving place, but it's such an intellectual resource to us, giving us feedback as to what public policy needs to be. Without characterizing his comments, mine are that they are not what is being put forth by the Republican shutdown in Washington, D.C. Dr. Kenneth Tai?
It's a little faint.
It's faint? Okay. It's a little, this thing's wide. Okay, can you hear better now? Okay. Dr. Kenneth Tai, thank you for hosting us here at NEM's PACE Center in Chinatown. We're grateful for the work that you do, and as I said, while it was faint, this is one of my favorite places because it meets the needs of the people in a way that is an intellectual resource to us back as to what really works. Not Dr. Tai's words, but mine. Very different from what the Republican shutdown is exacting on our country, on the health and well-being of the American people. I'm so proud to be joined by Kevin Mullen, who will be with us in a moment, whom I had the honor of sharing the representation of San Francisco with, and we're very proud to welcome from across the Golden Gate Bridge, Congressman Jared Hoffman. In 15 months, he will be the chairman. Now he's the top Democrat. He'll be the chairman of the Natural Resources Committee. All along, he's been a real champion for America's working families, and we're honored to have him with us. After this, we are here today to call attention and to hear what it means to people in their lives, to what the Republicans are doing with this shutdown of the government, and to make sure people understand what the challenge is. We could not vote for a bill that contained within it and the other legislation they passed this year, cutting $1 trillion out of Medicaid and SNAP. $1 trillion. Several $100 billion out of SNAP, feeding the children. A few days ago, earlier this week, we celebrated the 48th anniversary of SNAP when it's signed by President Carter. Feed the children, WIC, women, infant children, seniors, Meals on Wheels, and the rest. They would rather take food out of the mouths of babies so they can give a tax cut to the richest people in our country who really don't need it. And then on top of that, $600 billion out of Medicare, and a complete horror show when it comes to the Affordable Care Act. Now, I feel proprietary about the Affordable Care Act and what it has meant to millions of people now with their legislation, which they wanted us to vote for, Get out of here. Would double premiums for many, many people in our country, and again, that's practically unaffordable for most of them. So that's what the fight is about. Who are you here for? America's working family, or are you here for the richest people in our country? Clearly, the Democrats are on the side of America's working families, and the Republicans are there for the richest people in our country at the expense of Medicare, Medicaid, even Social Security. They have said, we haven't touched the benefits, but they're firing the staff. This is one of the big, in the spring when they were doing this was one of the most objected to provisions of what they were doing, to take away the staff from Social Security, to put obstacles to people getting their benefits. Okay, so after months of making life harder, more expensive, Trump and Republicans are now inflicting a painful shutdown on the American people because they refuse to protect America's health care. And Congress doesn't extend the Affordable Care's enhanced tax premium tax credits immediately. Hundreds of thousands of families, now we're talking about California only, will lose their health care. Millions more will see their costs skyrocket, including 1.7 million families in California. Working families already getting invoices about skyrocketing costs. They were going out the 1st of October. Current estimates show Americans would see their out-of-pocket premiums increase by over 100% if Republicans refuse to act. Republicans acted quickly to pass tax cuts for their billionaire buddies by July 4th. Oh, that was big. 4th of July, Liberation Day. We're giving money to the high end, taking it from the poor. Reverse Robin Hood. Where is Republican urgency to lower health care costs for families, farmers, small business owners, and veterans? Our veterans are taking a big hit in this as well. Democrats are united. Wouldn't you say?
I think so.
We were in our caucus just so proud of our leader, Hakeem Jeffries, going in there making the case for the people. Democrats are united. We want to quickly reopen government while addressing the Republican health care crisis and lowering health care costs for working families across America. Donald Trump and Republicans must quit trying to make the shutdown even worse and instead come back to the negotiating table so we can reach a bipartisan agreement to open up the government. Now, just so you understand, we passed the Affordable Care Act. We knew, and when we did it, we had to make a fight in the country. And we said we're not going away until we pass this legislation. If there's something in the way that's blocking it, we'll push open the gate. If the gate doesn't open, we'll climb the fence. If that doesn't work, we'll pole vault in. If that doesn't work, we're going to helicopter parachute in. When we passed the bill, this press said, which one did you do? I said, well, what we did is we pushed open the gate because the American people were with us there pushing open that gate. The courage of our members, but the mobilization of the people. And so when what's-his-name said when he was became president in 2017, it was inaugurated in 2017, the Affordable Care Act sucks. Forgive me, but I'm just quoting the leader of the free world. The Affordable Care Act sucks. We said, no, it doesn't. It cures. And we had 10,000 events around the country where people told their stories. We've had this conversation among ourselves, told their stories. My baby was born with a heart problem, cost millions of dollars in doctor bills. Affordable Care Act took care of it. My wife had breast cancer. My father, a stroke. Different people telling their stories, not talking about provisions of the bill, not talking about Democrats versus Republicans, just their own story. Nothing more eloquent than that, especially to a member of Congress. So again, this is what we're doing. We're mobilizing throughout the country, again, to make sure the public's voice is heard on this and that the Republicans in Congress know that the public is on to what they are doing. And so in that spirit, we are expecting, oh, he's here. Okay. As I said earlier, have the honor of sharing the representation of San Francisco with Kevin Mullen. He's going to speak next, but I also want to join in welcoming, as I mentioned earlier, the future chair of the Natural Resources Committee, a real leader in the Congress on issues that relate to the health and well-being of the American people, Jared Hoffman. Now it is my pleasure to yield the floor to the distinguished gentleman from San Francisco and San Mateo, Kevin Mullen.
All right, Kevin.
Thank you, Speaker Emerita Pelosi, for bringing us together this morning. Your continued leadership in our Democratic caucus and California delegation is so very appreciated, and the person who made the ACA a reality in this country. My House Democratic colleagues and I just got back to check in our districts. Unfortunately, House Republicans did not show up for work this week in Washington, D.C. Republicans control the House, the Senate, and the White House. This is their shutdown. They've chosen to shut the government down. A constituent called my office just this week and said they're scared their wife will die, that is a direct quote, if she loses access to her health care because of what's happening right now. People's lives are at stake here. This fight is about protecting your access to affordable health care. I serve on the House Energy and Commerce Committee, which has oversight over federal health care. Earlier this year, we had a 27-hour nonstop hearing where Democrats tried to stop Republicans from cutting billions of dollars from Medicaid. And now they're trying to make health care even more costly by harming programs like Covered California. Republicans want to strip away coverage from 15 million people, including 28,000 people in my 15th congressional district. Trump's plan will make health care more expensive for everyone, with some seeing their costs rise over 600%. This fight is the height of hypocrisy. The Republicans and Trump already saddled America's children and grandchildren with $4 trillion in additional debt on the national debt to fund tax cuts for the wealthy, and now they want you to pay even more for your health care. It is quite appropriate for us to be gathered here today at NEMS, an organization that truly cares about the health of our communities. NEMS is set to open up a facility in my hometown of South San Francisco. I'm so grateful for the incredible work that they do. The American people deserve a federal government that works for them. They deserve a functional system. We all deserve better. I urge Republicans to come to the table and support a fair, bipartisan budget and reopen the government. And with that, I'm pleased to turn it over to my colleague, our leader on the Natural Resources Committee, somebody who so ably represents Marin County, my colleague, Jared Huffman.
Thank you. Thanks, everybody. Thanks, Congressman Mullen, and thank you, Speaker Pelosi, for your leadership over many years and your leadership in this moment. I want to thank the providers and the experts and the community leaders that do such excellent work here in this clinic, and I think it's appropriate that in a moment where Democrats are taking a stand to stop the cuts, to save health care, that we're gathering in a place that is on the front line of the impacts of what will happen if we continue over this health care cliff that Republicans have created for this nation. Now, Democrats are united in this moment to end the cuts, to save health care, to do what we can on something that really matters in people's lives. When we talk about this enhanced premium tax credit that is set to expire, and the notices of premium increases will start going out, this is about to get very real for millions of Americans. Apparently, it's not yet real for the White House, not yet real for congressional Republicans. They're still goofing around with AI memes with sombreros, and they're on vacation while Democrats were back in Washington this week trying to do work. But it will get real when these notices go out. In my district alone, I have 37,000 people that use this enhanced premium tax credit. That lets them have health insurance because of what we did for them. And earlier this week, when we gathered on the Capitol steps without any Republicans, we heard some real-world stories about what this means for people. We heard from a part-time community college professor who has a cancer diagnosis and has medication that costs thousands and thousands of dollars every month. There's no way he could afford that. There's no way he could avoid terrible choices for himself and his family if that tax credit were allowed to expire, because what that means for him and for 37,000 people in my district and millions more around this country is that their premiums in some cases will double or triple. And that's something that I think calls all of us to just think about, who do we serve? What do we care about? Republicans have sort of answered that question with their big, ugly bill that makes unprecedented cuts to our healthcare safety net in order to fund trillions of dollars in tax giveaways to people who don't need it, to the billionaires, to the biggest corporations. We're taking a stand today to say enough. We are not going to continue to allow this. This is not normal. And folks, make no mistake, what's going on right now with the president's antics, which with his totally political manipulation of this government shutdown, is an attempt by a strongman dictator masquerading as a president to bully all of us into submission. Those of you on the other side of those cameras and microphones and notepads, he's trying to bully the free press into submission. He's trying to bully all of the institutions that are the connective tissue of democracy into submission. And we have never in the history of this country, I think, seen anything quite as cruel and heartless and disturbing and un-American as what we are seeing in this moment. So Democrats are taking a stand. It is about health care for millions of Americans, but it's also about the bigger moment of saying that we will not continue to normalize and greenlight this deeply destructive, un-American thing that is happening in our name. And with that, I'm going to hand it back to Speaker Pelosi.
Thank you very much, Congressman, for being here, for your leadership in the Congress and representing the views of your constituents. When you say 35,000, it's not just people, it's families. So it's many more people in San Francisco between what they're doing to Medicaid and what they're doing to the tax credits, the subsidies. It's well over 50,000 families that will be affected very positively. Now, our special guests, our VIPs, are people who are with us today. You'll hear from later Amanda Webb on behalf of a friend and Laurie Brumner. They're going to tell their stories. As I said before, we had 10,000 events across the country when they tried to go after it before. But before we do that, we're going to hear from our healthcare providers who are just fantastic in all of this. And that is, first, we're going to hear from Joanna Liu. She is the president of the San Francisco Clinic Consortium. You've seen her before at many of our events because she has been there to tell us what the consequences are of actions and the rest. She has been an inspiration to all of us. And I've said, and Dr. Tai and she have heard me say again and again, if we had a brand new country and we were starting from scratch, our healthcare system would begin by carpeting the country with the work that they do to have this consortium of clinics all over America. We have bipartisan support for this in the Congress, you understand, but it doesn't seem to reflect itself in their budget priorities. With that, with gratitude, I welcome Joanna Liu, Madam President of the San Francisco Clinic Consortium.
Good morning. At our 12 San Francisco Community Clinic Consortium member clinics, including NEMS, where we are today, we focus on one thing above all else, our patients. Like community health centers across the nation, we care for people in every stage of life. Children needing school immunizations, adults trying to prevent diabetes and heart disease, and seniors trying to manage their chronic conditions. Together, we provide primary, mental, and dental health care and other essential services to over 110,000 low-income San Franciscans. It's these patients, hardworking, proud, from every background, but not wealthy, who will stand to be hurt the most by the huge reductions in Medicaid in H.R. 1 and the expiration of Affordable Care Act subsidies. These are the same families that will be impacted by the cuts to SNAP benefits and the same seniors who will feel the ripple effects of future Medicare reductions driven by the huge deficit increase H.R. 1 creates. I'm here today because these are our people, our patients, our staff, our community. Their health needs are not political, they're practical. They're here in clinic today. They're human and they're urgent. We will be supporting patients who work multiple jobs but do not have the paperwork to satisfy the burdensome new work requirements just to keep their Medicaid coverage. We will be explaining to families who once had solid coverage under Covered California, over 27,000 people in San Francisco, why they can no longer afford the skyrocketing premiums, an estimated 88% increase here in San Francisco, without the tax credits that made insurance attainable. We will be talking to seniors who depend on Medicare-funded telehealth capabilities and services, which they can no longer access. We will be helping patients who come to us hungry because their SNAP benefits have been cut. We cannot look our patients in the face and tell them that after 15 years of hard-won progress, that we're moving backwards. That is why we're proud to stand here today with Speaker Emerita Pelosi, Congressman Mullen and Huffman, to call on Congress to keep healthcare funding a top priority. Federal funding for community health centers like our member clinics, like NEMS where we stand today, expired yesterday. That must change. Our patients and millions of them, like them across the country, deserve reliable access to high-quality, comprehensive health care not just today, not just tomorrow, but for the long term. I'm glad to welcome Dr. Ken Tai, Chief Health Officer here at NEMS, for the next remarks.
Good morning. My name is Dr. Tai. Welcome, everyone. First, I want to thank Speaker Emerita Pelosi for hosting today's press conference in our Chinatown clinic. For decades, she's been a true champion for the community health centers, both in San Francisco and nationwide. We are deeply grateful for her leadership. I also want to recognize Congress Millen, Congress Hoffman, and Johanna for their supports. NEMS was founded over 50 years ago in Chinatown. Today we have grown to 31 sites throughout the Bay Area, serving 83,000 patients every year. Majority of our patients are low income, 80% are on Medi-Cal or Medicare, 70% prefer to receive care in a language other than English. We provide mainly primary care, but we offer dental, behavioral health, pharmacy, lab, optometry, radiology, acupuncture, and specialty services. We also offer a PACE program for seniors and a residency program to train the next generations of primary care physicians. Our mission is simple and unwavering: to provide affordable, high quality, and culturally competent care for everyone. But that mission is at risk today. Federal cuts to the Medicaid program and the tax subsidies threaten to strip insurance coverage from millions of Californians. Work requirements, eligibility checks every 6 months could push 1/3 of the Medi-Cal patients off coverage. Added cost sharing will discourage additional patients from seeking care. We know what happens when people lose insurance. They delay preventive care, end up in emergency room with advanced conditions or complications, and face worse outcomes at higher costs. Some clinics in the Bay Area have already reduced their hours or closed. Lower federal fundings and provider tax revenue may also lead to cutting of optional benefits like vision, dental, behavioral health, and acupuncture. Community health clinics like NEMS are safety nets. If the net breaks, our most vulnerable members will fall through. These federal cuts are short-sighted, irresponsible, and harmful to our most vulnerable communities. At NEMS, we remain committed to serving all who come through our doors, but we cannot do this alone. Every dollar cut from the preventive care today will cost taxpayers 3 times more tomorrow. We urge policymakers to protect and strengthen fundings for Medicaid and tax subsidies and community health centers, because cutting resources today only leads to poorer health and higher costs tomorrow. On behalf of our patients and staff, thank you, Speaker Pelosi, Congressman Millen, and Congressman Hoffman, for your commitment to protect those who are vulnerable and needing care the most. Next, I would like to introduce Amanda Webb, who will share a personal story on behalf of a family friend. Amanda?
Thank you, Dr. Tai, and I want to express my gratitude to Speaker Emerita Pelosi for bringing us here today. My name is Amanda Webb. I'm a wife, a mother, a resident of San Francisco, and a stage 4 colon cancer survivor. Access to health care is so important to me. Much of my advocacy work is in service of the cancer community. But today, I'm not here to tell my story. I'm one of the lucky ones. I have access to a health insurance plan that I can afford. Today, I'm here to share the story of my friend Cinnamon. We met for a glass of wine just last night before picking up our sons from school. I mentioned the opportunity to share her story today. I thought I had her when I said, do it for the people. But Cinnamon's not here today. She graciously allowed me to share her story on her behalf because she knows how important it is to be heard. Cinnamon is a San Francisco native and a stay-at-home mom of 2 young boys. Last November, her husband was laid off, and she immediately applied for Medi-Cal. Just weeks later, her 4-year-old son became dangerously ill. After multiple ER visits, he was admitted to UCSF for a life-threatening C. diff infection. He spent 3 weeks in the hospital, came home on 9 different medications, and is still under the care of 4 specialists. Doctors haven't ruled out an autoimmune condition. Thanks to Medi-Cal, Cinnamon's family paid nothing. Without coverage, the hospital bill alone would have exceeded $300,000. It would have bankrupted them. After 9 long months of job searching, her husband landed a position at a well-known tech company. Cinnamon breathed a sigh of relief, thinking their family was finally secure. But as a contingent worker, her husband doesn't get the same health care benefits as regular employees. The family plan costs $2,000 a month, completely out of reach, even with this new income, and they no longer qualify for Medi-Cal. This is why health care tax credits matter so deeply. Without them, Cinnamon's family and thousands like hers could lose coverage altogether. They've done everything right. They've worked hard, applied for coverage, made responsible choices, and yet without these subsidies, they could still fall through the cracks. No parent should ever have to wonder if their child's life depends on whether they can afford an insurance premium. Extending the tax credits means families like Cinnamon's can stay protected, continue to recover, and live without fear of financial ruin. Open enrollment for Marketplace plans begins in November. Plans need time to update premiums for next year, which is why Congress cannot afford to wait and must act now. Families like Cinnamon's are counting on it. And with that, I'd like to welcome our next speaker, Lori Bremner. Thank you.
Thank you, Amanda. My name is Lori Bremner. I'm grateful to be here, to have this opportunity to beg Congress to extend the healthcare tax credits. They need to do it now. The need is urgent, before there's irreparable harm done to the health and the financial well-being of America's working families. Those healthcare tax credits were my lifeline. I was diagnosed with leukemia a long time ago, back when I was in college. I was on my parents' health plan then, and so that allowed us to access the treatments that put me into remission. My cancer never returned, but for years after that, I fought a battle of a different kind, a battle to be able to access affordable, quality health care. My situation's not uncommon. I'm a single mother, I'm self-employed, and I have a pre-existing condition. I was denied coverage over and over again until the passage of the Affordable Care Act. But thanks in large part to Speaker Emerita Pelosi, the ACA became law. I can still feel the excitement I felt on that day when I navigated the newly live Covered California website. But I was nervous too. What was it going to cost? Could I afford it? I had a decent income, but I'm sole financial support for my 3 sons and me. But then I saw it. I qualified for a significant tax credit. With that tax credit, the premium was affordable for me. That tax credit was life-changing for me and for my family. When people can't afford their health care premiums, they don't get checkups, they don't get preventative screenings, their chronic and acute conditions are diagnosed later, they get sicker, their treatments are more expensive, and they are more likely to die. Over 4 million people are set to lose their lifeline to those tax credits if they're not extended. More than 20 million people will see their costs skyrocket. They will lose their only option to affordable health care that they need. Now is the time for Congress to act. This is not a field on which you can back down. We are counting on our elected officials to put the health of working families first. The health care tax credits must be extended. I close by thanking the Speaker Emerita for one of the happiest days of my life. That was when I clicked the submit button at Covered California, and I was able to afford individual coverage for myself and my family for the first time in my life, and I wasn't even asked if I'd ever had cancer. Thank you.
As I said, there's nothing more eloquent than people telling their personal stories. Thank you, Amanda, for sharing your friend's story and partially yours. And again, Lori, thank you for that. What you have to understand is when we passed the Affordable Care Act, we had to pay for it, which was appropriate. And so we had the best we could do with the money that we could have. We put hundreds of billions of dollars to expand Medicare and the rest of that. So when we had Joe Biden became president, in the rescue package, we were able then to expand the tax credits. That meant that the subsidies could go to people with a little bit higher income and again reduce their cost. So this is really essential, and there's no way we're saying to the Republicans, oh, we'll keep government open so you can get a tax break to your rich friends at the cost of health care to America's working families. Just because my colleague mentioned the $4 trillion that they added to the national debt. When what's-his-name became president the first time, they had the only bill they passed with a Democratic House, Senate, and White House, the only bill they passed was one that gave a tax break to the wealthiest people in America. It added $2 trillion to the national debt if you include the interest on the national debt that was included. This time, they doubled down. They have nearly $4 trillion. So their leadership has added $6 trillion to the national debt for our children to pay, our grandchildren to pay over time, so they could give a tax break to the high end. A budget should be a statement of our national values, what we care about, what we have in our budget, as we prioritize. That is simply not the case in this case. So it's important for the American people to know why we couldn't vote with them on this bill, so that they will come forth and support the Affordable Care Act, Medicaid, and the rest, and SNAP. With that, we're happy to take any questions. Mr. Mullen, you can come over here and answer some questions.
Topic questions first. We're going to start with topic questions first. We've got just a couple minutes. So I'm Kelsey Doran with CBS News.
Yes.
You know, just talking about healthcare. Historically, the minority party, when they use a shutdown to kind of leverage the policy that they're looking to change, it has not been successful. So I'm just wondering why you think this time is different.
Because I believe in the American people. I believe that this is so essential. They may not understand about the tax cut or what do I care. Rich people always get the advantage. That's what sometimes they think. But this hits home for them. And that's why we're having, as we did before, 10,000 people to 10,000 events around the country for people to tell their stories. And in this case, that people know when they get this notice this week that their policies could possibly double or worse for their families, that they will weigh in with the Republicans. Nothing good happens in Congress, whether it was the passing Affordable Care Act, as I said earlier, outside mobilization, whether it's saving it 10,000 events, outside mobilization, and that's what we're doing now. Do my colleagues want to respond to that?
I have one thought. First of all, the last time we had a government shutdown, you're alluding to how politically tenable is it for the minority party. Those were shutdowns, and I experienced them from a minority party that was trying to take health care away from people, trying to repeal the Affordable Care Act. That's why they shut the government down the last time around, and President Trump was part of that government shutdown. So it's just a very different moment. They have complete control of government. If they want to do all these terrible things, they can do it with Republican votes. But the question is, are Democrats going to take a stand to protect health care, not to try to shut the government down to strip it away? It's a very different moment.
I guess a quick follow-up to that is, why would Republicans negotiate with you guys? This is kind of their one big thing that they've passed.
Well, because what they're doing is wrong. And why would we abandon our commitment to the American people and say, okay, we'll keep government open so that you can give tax breaks to the wealthiest people in our country. And by the way, when every shutdown has been a Republican shutdown. Why? Because they don't believe in governance. They just don't believe in it. They didn't vote for Social Security, Medicare, Medicaid, Affordable Care Act, none of it. They don't believe in governance. So for them, a shutdown is a day at the beach. They love it. No government. And when we had, not the last one, the president, the last one under Trump, he was 35 days. And when it began, he said, I will be very proud. Be proud. Remember he said that? I mean, I was in the Oval Office when he said this. I will be very proud of the shutdown that we're going to instigate. When they did it before, and we finally came back and they agreed to open up government, most of their leadership all voted to keep government shut down. So understand that. Did you have something you were saying on this?
I would just simply add, my colleagues are veterans. I'm still relatively new to the Congress. This is my first Republican shutdown. And I just want to say, I believe the American people are with us on this issue. But I need to remind people, they have unified control. The House, the Senate, the White House, they run the government. They have the levers of power. Now, that's going to change in November of 2026 if we carry our message to the American people, because I believe they are with us. If I could just, as long as I have the microphone, I just want to emphasize something that Speaker Merida highlighted. That one big, ugly budget bill is generational theft. Tax cuts for the wealthy and corporations, and not only continuing, but extending them and expanding them, and adding $4 trillion to the debt. I have two 7-year-old boys. They are going to have to pay off that debt unless we can take control back, and I believe we will. But we need to restore fiscal sanity to this country, and the way budgets are crafted is a statement of the priorities of the people. I believe the people ultimately will be with us on this.
As was mentioned, Congressman Hoffman is going to be the chair of the Natural Resources Committee. He's a leader there now. And of interest to many people in our areas, what's happening to parks and all this.
So I wish I could tell you with full disclosure from the administration exactly what was happening in parks, but we're left to sort of figure it out from the on-the-ground experience that people are having. We know that some park units are nominally open, but not all facilities in those units are open. Some are closed. I represent Muir Woods. It's shut down. We know that some parts of GGNRA are shut down, but the disturbing part is the pieces of this system that are left nominally open are operating with more than half of the personnel furloughed. And that is a little bit like keeping an airport open while cutting the air traffic controllers in half. It's not a good thing. Bad things will happen in terms of resource damage, in terms of public safety, in terms of any number of things that we worry about. It is no way to run the national park system. So we are seeing some raw politics play out in the way the president is manipulating all of this. I have no doubt that he will look for ways to try to make blue states and blue communities feel the pain while protecting his friends. That's sort of the mafioso leadership that we're seeing from this president. But, you know, giving in to that thuggery should be unthinkable, especially when the health care for millions of American people is the price that we would pay.
We have one more question? Yes.
One of the threats from the president is that there's going to be widespread firings of federal employees if there is an appeal soon. Any concern about that?
Yeah, there's very serious concern about that, and thank you for that question, because the fact is they're firing these people with or without a shutdown. Our members know that. They're firing without it, and now they're using the shutdown as an excuse. I wish I had the chairman of the Office of Management Budget statement. Public employees are villains. They're going to suffer. There's going to be trauma. There's going to be trauma for them. They do not believe in governance. I appreciate your question because it enables me to say what we know and we will see is they're firing these people anyway. Now they want to blame it on the shutdown, but it's happening anyway. As I said in March, when we're having this fight then, they were already firing the people at Social Security. They do not believe in governance. Let me just say, when you're asking about why, with all respect to your question, when people come to us and say they want to run for office, I always say to them, why? Know your why, right? We hear this all the time. Know why, because this is a big sacrifice to your family and this or that. Know your why. My why is 1 in 5 children in America lives in poverty and goes to sleep hungry at night. So my judgment about anybody I'm interacting with, whatever level of government is this, are you hurting the children? And this President of the United States is doing horrible damage to the children, to their families, whether it's SNAP and the food they eat, whether it's health care for their families. This is an economic issue, too. The parks are an economic and jobs issue, too. So this has a terrible effect on our country, and this is a values debate. As I said, a budget should be a statement of our national values. This budget issue that they're bringing up is certainly not. In fact, to the contrary, it's very harmful.
Quick follow-up, we're on day 2. The last one lasted 35 days.
Yes. Mm-hmm.
How long are y'all willing to hold out?
What a question. It's interesting, your perspective on this. We are not voting for anything that takes away health care from America's working families, whether it's by overturning the subsidies of the Affordable Care Act, whether it is hundreds of billions of dollars for Medicaid. Let me just say this on the Medicaid thing, because you mentioned this. Both of our guests referenced this. What they're saying in D.C. is, I think these people, if they don't work, they shouldn't have Medicaid. Then they go to work and they make too much money to be on Medicaid. And that's a big win for them. We got rid of them on Medicaid, and that's not just simply not right. Because many of the people that are not working, or they're taking care of children or an elderly person, if there's a few that should not be there, then let's see what that is. But don't say, you go to work, because the minute you make a little more money, you're off the program. Any comments from any of our guests on any of this? No? Yes? Okay. Well, thank you all.
What's your message to Americans, to federal workers who are going to have to be going without pay while these negotiations play out?
Well, quite frankly, the message is from them.
Yeah.
It's from them.
Yeah,
That's not right?
exactly.
Well, do you want to speak to that?
Oh, no. We're hearing loud and clear from these federal workers who are traumatized. You know, when Russ Vought said he wanted federal employees to be traumatized when they go to work every day, what kind of creepy, cruel monster even thinks that way, let alone says it as the head of Office of Management and Budget? Well, it's working. I mean, these folks are traumatized, and many of them have already been let go. So we are hearing from them loud and clear to not normalize this, to not give in, to stand and fight. And it is really for them, in large part, that we are standing our ground and fighting right now.
And because you asked that question, may I just say, we have such high regard for our federal workers, many of them in our area here, but across the country. They're there to do the work for the people, and they should deserve much more respect than this administration gives them, and the Republicans have given them in the past. Whether we're talking about Social Security or our parks or health care, in every area of governance, our federal employees deserve to be exalted, not traumatized. Thank you all very much.
One last question. The Trump administration has alleged that Democratic proposal would allow California to continue a loophole in voting here, to exploit a loophole to fund Medicaid for undocumented immigrants. Any elected officials respond to that allegation?
You're on my turf now. This is my wheelhouse. I'll write most of these bills. The federal government does not, and no federal dollars are spent on people who are undocumented. Thank you.
Thank you.
Yeah.